Hey there, welcome back to our channel. Today, we're diving into a critical health topic that affects millions of men worldwide. Are you or someone you know struggling with an enlarged prostate? Don't miss this video. Warning: 4 common mistakes could be making your symptoms worse. Stick around to find out what they are and how you can avoid them. Let's get started. An enlarged prostate, medically known as benign prostatic hyperplasia, BPH, is a common condition where the prostate gland enlarges as men age. The prostate is a small gland that is part of the male reproductive system, located below the bladder and surrounding the urethra, the tube that carries urine from the bladder out of the body. The exact cause of BPH is not fully understood, but it is believed to be related to hormonal changes as men age. Specifically, changes in the balance of sex hormones, such as testosterone and estrogen, may contribute to the growth of the prostate. As the prostate enlarges, it can press against the urethra, causing various urinary symptoms, such as frequent need to urinate, especially at night, nocturia, difficulty starting urination, hesitancy, weak or interrupted urine stream, dribbling at the end of urination, inability to completely empty the bladder, urinary urgency and leaking or incontinence. Severe BPH can block the urethra completely, making it impossible to urinate. This can cause bladder damage and may require emergency medical treatment. Over time, incomplete bladder emptying can lead to stretching and weakening of the bladder muscles, causing loss of bladder function. If BPH causes high pressure in the bladder, it can damage the kidneys by impairing their ability to drain urine properly. Incomplete emptying of the bladder can lead to bacterial growth and recurrent infections. These can form due to residual urine in the bladder and can cause infection, bladder irritation, blood in the urine, and obstruction of urine flow. Diagnosis typically involves a combination of medical history, physical examination, including a digital rectal exam, urine tests, blood tests, and imaging tests like ultrasound. Here are 4 common mistakes that can worsen enlarged prostate symptoms and tips on how to avoid them. 1. Ignoring fluid intake. Mistake: not managing fluid intake properly. Why it's bad: drinking too much fluid, especially before bedtime, can increase the frequency and urgency of urination. On the other hand, not drinking enough can lead to concentrated urine, which irritates the bladder. Tip: drink fluids throughout the day but reduce intake in the evening. Avoid beverages that can irritate the bladder, such as caffeine and alcohol. 1. Sedentary lifestyle. Mistake: leading a sedentary lifestyle with little physical activity. Why it's bad: lack of exercise can lead to obesity, which is associated with worsening BPH symptoms. Physical inactivity can also lead to poor blood circulation, which affects prostate health. Tip: engage in regular physical activity. Aim for at least 30 minutes of moderate exercise, such as walking, swimming, or cycling, most days of the week. 3. Ignoring the urge to urinate. Mistake: holding in urine for extended periods. Why it's bad: ignoring the urge to urinate can overstretch the bladder muscles and lead to bladder dysfunction over time, making it harder to fully empty the bladder. Tip: respond to the urge to urinate promptly. Establish regular bathroom habits to avoid bladder overdistension. 4. Poor dietary choices. Mistake: consuming a diet high in processed foods and low in essential nutrients. Why it's bad: a diet lacking in vegetables, fruits, and healthy fats can contribute to inflammation and worsen prostate health. Processed foods often contain additives that can irritate the bladder. Tip: follow a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Incorporate foods that are beneficial for prostate health, such as tomatoes, rich in lycopene, berries, nuts, and fish high in omega-3 fatty acids. Being aware of these common mistakes and making appropriate lifestyle adjustments can significantly alleviate symptoms of an enlarged prostate. Always consult with a healthcare provider for personalized advice and treatment options tailored to your specific needs. By taking proactive steps, you can manage BPH symptoms more effectively and improve your quality of life. Treatment options vary based on the severity of symptoms and may include lifestyle changes: reducing fluid intake before bedtime, avoiding alcohol and caffeine, and bladder training exercises. Medications: alpha blockers to relax bladder neck muscles and prostate muscle fibers, and 5-alpha reductase inhibitors to shrink the prostate. Minimally invasive procedures: transurethral microwave thermotherapy, TUMT, transurethral needle ablation, TUNA, and others. Surgery: transurethral resection of the prostate, TURP. Laser therapy and other surgical options may be considered for severe cases. Regular checkups and monitoring are important to manage BPH and prevent complications. If you experience symptoms of an enlarged prostate, it is advisable to consult a healthcare provider for evaluation and appropriate treatment. And there you have it, folks. Avoid these 4 common mistakes to help manage your enlarged prostate symptoms more effectively. If you found this video helpful, make sure to give it a thumbs up and share it with anyone who might benefit from this information. Don't forget to subscribe to our channel and hit the bell icon so you never miss an update. We've got plenty more health tips and advice coming your way. Thanks for watching, and take care of yourself.